Hi, my name is Brandi Rollins, and I am a postdoctoral scholar at Penn State at the Center for Childhood Obesity Research, and today I presented a talk at the Obesity Risk Mini Symposium. The talk it focused on looking at children's eating of candy in a free access environment. And we were particularly interested in seeing how much candy do children consume when given free access following a meal. And we were also interested in seeing what parenting practices were associated with their intake of that candy in that free access environment. And basically what we found was that children eat a lot of candy, even following a meal. When they report that they are no longer hungry, we found that they were eating about 200 calories of candy, and we had both non-chocolate and chocolate candies, and they were consuming on average, about 100 calories from each candy category. And we also found that, however, they did actually have a little bit more of a preference for almost all the children consumed the non-chocolate candies, so more like the sugar candies or the hard candies, whereas about 77% of the children 77% of the children consume calories from chocolate. So there was a little bit more of a bias towards the sugar candies, and that may be reflective in terms of reflected based on that parents tend to parent differently around non-chocolate and chocolate candy. From our focus groups, we've learned that parents tend to be a little more restrictive when it comes to non-chocolate candy. Chocolate is often viewed as a healthier form of candy, and so it's made a little bit more available than sugar candy or non-chocolate candy within the home. And children also show a greater preference for the non-chocolate candy, so those two things combined may be fueling some of the bias that we saw towards all the children, almost all the children going and consuming calories from the non-chocolate candy. And so that was intake. And the other thing that we were looking at was parents' self-reports of parenting and feeding practices and how that was predicting children's intake of candy in this free access environment. So in terms of what I say free access environment, it's basically we brought them into the lab and we fed them a standard lunch, and we made sure that they weren't hungry before giving them access to a variety of different kinds of candy. And so what we found was that children whose parents reported greater use of authoritarian control in parenting, so that kind of dominant pressure-based kind of parenting, that those children consumed more of the non-chocolate candy in this free access paradigm. We also found that when parents who used more restriction, who were more controlling in terms of what types of foods their children can have access to, those children also consumed more calories from the non-chocolate candy. And we saw an inverse when we looked at parenting that was more structure-based, so parenting that provided more guidance and rules and routines and considered the child's perspective, and that it was more protective of children's eating behaviors, and in a sense that they consumed less of the non-chocolate candy in the free access task. So in conclusion, we found that children eat a lot of candy, and parenting definitely has an effect in our preliminary data to show that more control equates to more overconsumption of non-chocolate candy in free access environments, whereas the opposite is true of more supportive parenting.